Okay, let's talk about something that's really common but also can be incredibly painful. Anal fissures. The thing is, while they're no fun at all, they are very, very treatable. In this explainer, we're going to walk you through exactly what they are, why they can be so stubborn, and all the most effective ways to heal, all based on solid medical research.
So if you've been experiencing that sharp, almost like a tearing pain, and maybe you've seen a little bit of bright red blood when you go to the bathroom, those are the absolute classic signs of an anal fissure. Now, I know that sounds alarming, but the most important thing you need to know right now is that this is a highly treatable condition.
All right, so let's get right into it. First things first, what exactly is an anal fissure? Understanding what we're dealing with is always the first step to feeling better. To put it as simply as possible, an anal fissure is just a small cut or tear in the very sensitive skin of your anal canal. The easiest way to think about it is like a paper cut, just in a really, really delicate spot. And that's what's causing that sharp pain and sometimes a little bit of bleeding.
Now, this is actually pretty interesting. Where the tear happens is a huge part of the story. About 90% of the time, these fissures pop up in a very specific place, the back midline of the anal opening. And it turns out that spot just naturally has less blood flow, which can make it a whole lot harder for the tear to heal up on its own.
So you'll hear doctors talk about two types of fissures, and it really just depends on how long it's been going on. An acute fissure is a new one. It's been there for less than 6 weeks. It looks like a fresh little tear, and honestly, it has a really good chance of healing with just some simple care. But a chronic fissure, well, that's one that's stuck around for more than 6 weeks. It might have developed some tougher edges and usually needs a bit more medical help to finally go away.
Okay, this next part, this is probably the most important thing to understand in this whole explainer. Why do some of these fissures become chronic and just refuse to heal? It's not just about the cut. It's about a frustrating cycle the body gets trapped in.
I mean, you might be wondering, it's just a tiny tear, right? Why doesn't it heal up like a cut on my finger? Well, the answer has everything to do with the unique muscles in that area and a powerful reaction that you can't even control.
And here it is. This is the vicious cycle. You have to understand this to understand the treatment. It all starts with the tear, which, as we know, causes a lot of pain. That pain makes the internal anal sphincter muscle, a muscle you don't consciously control, to just spasm and clamp down really hard. Well, that spasm squeezes the tiny blood vessels, cutting off blood flow to the tear. And without a good blood supply, the fissure can't get the oxygen and nutrients it needs to heal. So what happens? The next bowel movement hurts, which causes another spasm, and on it goes.
But here's the fantastic news. Once you understand that cycle, you realize that every single treatment we're about to talk about is designed to do one thing: break it. And the first line of defense involves simple things you can do right at home to give your body a fighting chance to heal itself.
So the main goal here is to make sure bowel movements are soft and easy, so you're not re-injuring that spot over and over. That means more fiber, more water, maybe some stool softeners, and definitely no straining. On top of that, sitz baths, which is just soaking in a few inches of warm water for about 10 or 15 minutes a couple of times a day, are just amazing. They help that spasming muscle to finally relax, which feels great, and helps bring that crucial blood flow back to the area.
Now, for a lot of folks, especially if the fissure is new, these simple steps are all it takes. The research shows that somewhere between 16 and 31% of fissures will clear up with just these conservative measures. But what if they don't? Well, that's when we move on to some highly effective medical treatments.
So if that at-home care just isn't cutting it, the next step is to talk to your doctor about medical treatments. These are medications designed to directly go after that muscle spasm, which we now know is the key to breaking the whole cycle of pain. Basically, there are two main types of creams they might prescribe. The first ones are called topical nitrates. They work really well to relax that sphincter muscle. But there's a catch. A very common side effect is headaches. The second type, though, are topical calcium channel blockers. And these are great because they are just as effective at relaxing the muscle and getting the blood flowing again, but with way fewer side effects. So it's kind of a no-brainer, right? Because they work just as well, but are so much easier for people to tolerate. These topical calcium channel blockers are now considered the first-line medical treatment for chronic fissures. They get right to the root of the problem.
And wow, can they be effective? Check this out. One major study found that a specific nifedipine cream, which is a calcium channel blocker, healed acute fissures in 95% of patients in just 3 weeks. That is a fantastic result. Okay, so let's say the creams don't quite get you over the finish line. The next option is something you've probably heard of in a different context: botulinum toxin, or Botox. The way it works here is by temporarily paralyzing a tiny part of that internal sphincter muscle, which forces it to relax for a few months. That gives the fissure a really long, uninterrupted window to heal. It's a single treatment, but the healing rates in studies do vary quite a bit.
All right, for those really stubborn, chronic fissures that just won't heal no matter what you throw at them, there is a surgical option. And this is considered the most effective, most definitive solution out there.
And I'm not just saying that. The experts, the American Society of Colon and Rectal Surgeons, literally call this procedure the gold standard for treating chronic anal fissures. It's called a lateral internal sphincterotomy, or LIS for short, and it has the best success rate of anything available. And when you look at the numbers, you can see why. The data is pretty clear. While medical treatments like creams or Botox heal about half of chronic fissures, LIS boasts a success rate of 88 to 100%. It's a really precise procedure where a surgeon makes a tiny cut in that internal sphincter muscle, which permanently relieves the spasm and lets the fissure heal for good. But I know what you're thinking. Anytime someone says surgery and sphincter muscle in the same sentence, there's one big question that comes to mind, right? What about the risk to bowel control? It's a completely valid concern.
So let's be upfront about it. There is a risk of some minor, long-term incontinence. Usually it's to gas or a tiny bit of leakage, and studies report that risk is somewhere between 8 and 30%. But, and this is a really important but, modern surgeons use what's called a tailored technique. They only divide the muscle just up to the level of the fissure, saving as much of it as possible. This approach has been shown to dramatically lower that risk while still getting those incredible healing rates.
Okay, we have covered a lot of ground. So let's just boil it all down to the most important points for you to take with you as you figure out your own path to healing.
Okay, number 1, this is a treatable condition. Remember that. The real enemy here isn't a tear itself, it's that vicious cycle of pain and muscle spasm. And the great news is there's a clear, step-by-step ladder of treatment options. You can start with simple at-home care, move to medical options, and if needed, surgery to break that cycle and finally get lasting relief. Look, our whole goal here was to arm you with the information you need to feel confident and in control. You understand what's happening in your body now, and you know there's a clear path to getting better. So the only question left is, are you ready to take that next step and have a really good, informed conversation with your doctor to find the right treatment for you?